Hello everyone, my name is Dr. Stefan Ivantu. I am a consultant psychiatrist specializing in adult ADHD. Today I'm going to speak about ADHD and sleep difficulties. People suffering from ADHD are more likely to have trouble falling asleep and getting up in time. Some may prefer having a flexible schedule or starting work later in the day. When ADHD is diagnosed and managed appropriately, the sleep pattern can improve by itself. However, in some situations, the sleep issues may be attributed to a comorbid sleep disorder, environmental factors, or can also remain treatment resistant. It is well known that in some recent studies, approximately 50 to 80% of adults with mental illness have difficulty in falling and staying asleep. The most common sleep disorder in ADHD is the circadian rhythm sleep disorder. So what is circadian rhythm disorder? This is by far the most common condition seen in teenagers, but also in adults suffering from ADHD. They are more awake in the evening and during the night, and they wake up later in the day. This makes it difficult to adhere to a fixed work schedule or take on academic commitments given the unusual pattern. In some cases, implementing sleep hygiene and light therapy helps with this disorder. One of the biggest challenges remains the sustainability of a more in-control sleep cycle in ADHD. However, with a holistic approach, an improvement may become attainable. What is narcolepsy? The link between narcolepsy and ADHD is quite strong. The main symptom of this condition is excessive daytime sleepiness. A diagnosis of narcolepsy can be masked for many years in people suffering from ADHD, and they can be seen by others as work shy, or they may be even called lazy. Some studies indicate that people suffering from narcolepsy have a higher prevalence of ADHD, somewhere between 15 and 30%. Some of the symptoms of narcolepsy are the following: excessive daytime sleepiness, changes in rapid eye movement sleep, the REM sleep, cataplexy, which is described as sudden muscular weakness triggered by emotions, sleep paralysis, or certain types of sleep-associated hallucinations, which I'm not going to detail in this video. Symptoms of narcolepsy in someone suffering from ADHD can improve in the long term when having access to appropriate support. Another condition is the restless leg syndrome, because people having this condition, they have the impression of constant shivering affecting their legs, and this makes it challenging to fall asleep. Some studies claim that people with ADHD are more likely to experience this condition. The main symptoms of restless leg syndrome are the following: the urge to move the legs, a sensation that begins while resting, worsening of the symptoms occurs in the evening, and there is a relief with movement. Sleep disordered breathing. The association between sleep apnea and ADHD is well established in children. Sleep difficulty and daytime tiredness are common symptoms of sleep disorder breathing. New research indicates a link between obstructive sleep apnea, obesity, and attention deficit hyperactive disorder. Some of the symptoms of obstructive sleep apnea are episodes of stopped breathing during sleep, loud snoring, excessive daytime sleepiness, morning headache, irritability, and difficulty concentrating during the day. Can brown noise help with sleep? Well, brown noise exists in the nature. Therefore, from an evolutionary perspective, some may say that there is a link. More time and research are needed to precisely indicate the usefulness and limitations of different sound colors in adults suffering from ADHD. To read more about the brown noise in ADHD, please check my blog. Conclusions. People suffering from ADHD are more likely to have disturbed quality of sleep patterns and duration of sleep. Mental health and sleep are very closely connected, and those suffering from ADHD are much affected by this link. Beyond implementing sleep hygiene, there are many reasons why someone might not be able to sleep well. However, in the general population, approximately 18%, or almost 1 in 5, they suffer from a chronic sleep disorder, while in people diagnosed with a mental health condition, including ADHD, more than half report having difficulties with sleep. The journey of having a better sleep can be for some a marathon rather than a sprint. People suffering from ADHD have higher than average rates of certain sleep disorders in addition to generalized insomnia. The underlying sleep conditions may go untreated for years because the ADHD symptoms can frequently overlap the symptoms of sleep disorders. This can become complex since the sleep disorders can mask the inattentive ADHD symptoms. Having the appropriate support can significantly improve your quality of life and well-being.